Well, a rather shocking story of Nicola Seal there. Richard Baines, who compiled today's investigation, still here, and also joined by Dr. Andrew Seaton, who's a GP, and you heard him in that report. Andrew, coming to you first, I mean, how do you account for someone like Nicola? I mean, that is very shocking story, a very active young woman who wants to be out and about, certainly, by her own thoughts, no psychological effect here, and yet long-term debilitating effects.
I mean, I don't want to discuss specific elements of any particular case.
Sure, but someone like her, I mean, I take it she's not a single case.
No, well, I think that there's no doubt that Lyme disease occurs, and the early signs of Lyme disease may be missed, and I think it's incumbent on all healthcare practitioners to be aware of the early signs, and even for patients to be aware of the early signs and to flag them up early. And for early diagnosis, that's the key issue.
But there seemed to be something different here from what she was saying, because clearly she went to the private sector in order to get long-term antibiotic treatment, which she felt was beneficial, but at quite some cost, £13,000, whereas the NHS stance is that, no, that's not appropriate. So there's a clear difference of opinion here, isn't there?
Well, I'm not sure about what particular treatment Nicola had in the first case, but certainly all the recognised treatments are available on the National Health Service, and that's usually a course of oral antibiotics for 2 to 3 weeks. And for more complex cases, parenteral therapy, again, for 2 to 3 weeks. So that treatment is available on the National Health Service. Well,
I mean, Richard, you spent a long time speaking to Nicola, and indeed to other people. And of course, Andrew, we don't want to focus specifically on that one case. But what was the absolute essence of her gripe, if you like?
The essence of her gripe is that she believes, having looked into it herself, having investigated the illness herself, that the correct treatment, and there are people who advocate this, there are medical people, doctors who advocate this, that the correct treatment is a long-term course of antibiotics for months or even years, starting with as much as 3 months intravenous or parenteral antibiotics. That's what she says she needed. That's what she had, and after having that, she's on the road to recovery. I spoke to her on Thursday, and she's a lot better, and she's hoping that she can get back to being active again.
I mean, Andrew, I knew that you outlined in the piece that there are negative aspects to long-term antibiotic use, and it's certainly not something that you would do lightly, but would there not be instances, judging it on a case-by-case basis, that it would appear to be appropriate, and, this being one of them?
Certainly. Myself and colleagues in infectious diseases in the UK, you'd be hard pressed to find any of us that would advocate very long courses of treatment. If we take neurosyphilis, for instance, syphilis is a similar kind of organism. Obviously, it's transmitted in completely different ways, but we know that when that particular organism affects the central nervous system, a 21-day course of therapy is curative, and we know that the lethality of that kind of infection and the serious neurological consequences, are without doubt. Longer courses of therapy for that particular related condition are not advocated.
So what do you say to the person who says, "Well, I'm sorry, doctor, your short treatment, your short course of antibiotics didn't work, and I can't have the life that I had before. I can't walk the way I could before. My mobility is hindered." I mean, what do you say to them?
Well, the other side of it is to think about other potential factors, and there may be psychological factors.
Which seems to have been ruled out in her case.
There may be other aspects to do with physical rehabilitation, and so in the piece we mentioned graduated exercise programs, as have been shown to have been of benefit in chronic fatigue syndrome.
Right. Okay.
So there I think it's important to explore other reasons. Certainly, on occasions, longer courses of treatment can be advocated, but really, my own experience is not the very long courses of treatment that are advocated by some, and that which you don't find in the peer-reviewed published guidance.
Okay. Well, we will pick this up, but we have calls in, and so I'd like to speak to Joan. Morning, Joan. How are you?
Oh, good morning, Kay. Yes, quite well, thank you.
You're familiar with Lyme disease, yeah?
Yes, indeed. Over a very long period, both my husband and myself were diagnosed about 8 months ago with the disease. And since then we've had, I would say, 6 weeks of antibiotic treatment. First of all, there was 3 weeks of oral, and then later there was 3 weeks of intravenous. With myself, I think it's been more or less successful, but not with my husband. He's still very debilitated. His walking is becoming increasingly worse, and he's been affected neurologically.
Right. What other effects then, Joan, when you say affected neurologically?
Well, his balance and his walking.
Right.
That's the most serious. He did he expected a more extensive treatment, but he was told that the consultant would not recommend that.
When you say more extensive treatment, Joan, do you mean an extended course of antibiotics?
Yes, he did expect, I think, at least 3 months.
Right.
But he was told that it was not required and that they would not recommend it.
Right. So what are the doctors saying to him now that 8 months on he's still suffering, debilitating symptoms?
There's not a lot that they are saying, really. He's been encouraged to have exercise and aqua care and all the rest of it, but it doesn't seem to be effective in any way. In fact, I think in some ways he's deteriorating in his ability to walk.
Dr. Seaton, what do you make of that?
Again, you have my my sympathies, Joan, and for your husband. Obviously, it would be of concern if your husband has got ongoing debilitating symptoms, and I would hope your family doctor and perhaps neurologist, whoever it is who has been seeing you, can help you further with this. But I would certainly be going back to your GP and flagging up these symptoms.
It does sound, I mean, again, we can't comment, it's very difficult, but it sounds a bit inadequate. Would you not agree?
I don't know the details, and it's obviously not appropriate for me to comment on specific details. But I'm sorry he's got ongoing symptoms. It's well known that you can have chronic fatigue type symptoms, which will include some neurological type symptoms following proven or definite Lyme, and indeed following the medical treatment of Lyme disease. What the clinical trials have shown is that further antibiotic therapy that is not shown to be of any positive benefit. And indeed, as I mentioned again in the piece, long-term antibiotic therapy may be associated with some quite serious side effects.
Right, okay. Joan, have you been offered... Joan's gone. I think we heard that little beep that Joan was gone. We have other calls coming in. We will speak to them in just a wee tick, I'm sorry. Isn't it terrible how that happens in your head? In a second, because Fred's here. Hello, Fred. What have you got for us this Maybank holiday?
We've got a wee bit of health as well this morning. Don Skelton's coming in, and we're going to be talking about healthy bones. So what you can do to encourage the good, strong bones in your body. It's not just about drinking a glass of milk.
I was about to say, is it a glass of milk?
Jim McDonald from Coronation Street, actor Charles.
Jim McDonald! Get into that accent.
What about you?
What about you,
hey,
you are?
Fred.
Here's a pint.
He's in the sits this week. He starts on Wednesday. So he's here already. So
What's he in?
He's going to pop in. Blue Hen.
Oh, right.
So,
is it in an Irish accent?
I don't know. I'll ask him.
He probably comes from Surrey and talks like that.
Not at all. No, I've spoken to him, Charles, in the past. He's a great guy. Looking forward to catching up. David Shookman is the BBC's environmental correspondent. He's got a book out, but it travels all over the world. And then we've got Gary Marshall looking at new gadgetry this morning. A powered suitcase.
A powered suitcase? Oh, so you don't even have to drag it?
You don't have to drag it. My worry is it's going to be so heavy there's no space for any of your smalls. And as always, Kay, on a Monday, and given that this is a public holiday, it might be tough. It's over to the listeners. Anything they'd like to know for the last 10 minutes of the show, it's up to them.
That's a silly idea, powered suitcase. I mean, you're going to get people who are going to attach souped-up engines to it, and you're going to be in the airport, and somebody's going to take your legs off.
That's it. His suitcase faster than mine. Speedy boarding.
Where do you get some of this stuff? Right, well, I'll certainly be listening in.
On the programme, 10:05.
10:05, I'll be listening in to hear about powered suitcases. I've got a Porsche suitcase. Oh, it just gets ridiculous, doesn't it? Let's have some travel.